I'm not political whatsoever, but this is going too far. A couple years ago, my dad was in a really bad plane crash. He was flying his ultralight and something in the engine cut out and he nosedived. He fell into a cornfield and he broke his hip. Luckily, that was the only thing that happened. He had a couple bruises, but the break was the worst of the things. He got into the hospital. He got a semi-private room, even though his insurance was covered a private room. And he got a steel pipe placed in his hip to keep everything together. Now, on Tuesday, he was scheduled for an operation. He spent $60 on a taxi to get him from our house into Windsor. So he got there. He got registered. He got to the room where they were waiting for him. They were going to have him wait. Sitting there in his little jammies. And they came in half an hour after his scheduled operation time to say, yeah, we can't do it today. No, normally that'd be, just an irritant, whatever. But that was the third time they'd done that to him. The first time they canceled a month previous. Fine. Second time, it was a day. Not as great. But now, he has to get an appointment to see the specialist, which will take about 6 months. Then he has to wait for the surgery, which will take about another 6 months. My dad also has carpal tunnel. He went to a doctor and the doctor said, oh yeah, I can have you scheduled for surgery for this in 2 weeks. My dad's friend has a heart condition, and he can't get surgery on that for a couple years. That's skewed. One of my friends is a carpenter. He has 3 cracks in his rotator cuff. If he wants to get it fixed, which he just figured out he had after several months, if he wants to get it fixed, he has to wait 6 months to a year to see a specialist, 6 months to a year for surgery. Meanwhile, he still has to work. He still has to play with his 1-year-old. And if you can't lift your arm, good luck, right? Canada's healthcare is free. And we're extremely proud of this fact because there's about 40 million people in the United States who don't have free healthcare or don't have healthcare. So we're always against anything that would make healthcare cost anything. Especially since if it was a tiered system, everyone thinks that everything would more likely shift in the direction of people that could pay and that would. And, chances are it would. But right now they're already screwing over the little guy. Okay? I was reading an article in the New York Times because I was really incensed about what was going on with my dad and what was going on with my friend. And it was just incredible, the things that happen. The government is cutting back on everything to reduce the deficit. They're cutting back healthcare. They're closing hospitals. They're telling doctors, no, you can't work in big cities like Toronto. You have to go out and work somewhere else. So what do the doctors do? They go, alright, and they go to the States. That doesn't make sense. Part of the article mentioned that there is, I don't even know how many, women in Windsor, which is where I'm from, who are denied prenatal care. They couldn't go see an obstetrician, so they had to go across the border to Detroit. So now, after their water breaks, they have to try and get through the traffic at the border, which is the busiest border crossing in all of Canada, to get to the doctor. And then they find parking, good luck. and then they can go deliver their baby. Once the baby arrives, it's an American citizen. It's not Canadian. Now they have to go through the government again to get their child registered as a Canadian. Doctors are leaving Canada because the States, it pays better. My mom went and she worked at a Detroit hospital for a while because it paid better. It was her third job. She had 2 jobs in Canada as a nurse and a paramedic. There are people who need to increase their who need healthcare to increase their standard of life. There are people who are on waiting lists forever for transplants, for life-saving surgeries. But no, they have to wait several years before they can go see anybody, before they can get a consultation. Like, seriously. I think it said that there was a shortage of about 22,000 doctors in all of Canada. I know 2 people who want to be doctors and are in school for it. 2 out of 22,000. Now, with the baby boom, the largest demographic in Canada is getting older. Eventually, they're all going to retire. Eventually, they're all going to need extra healthcare, which is going to put an even greater pressure on the healthcare system. Which, let's be honest, can't deal with the pressure it has on it now. As seniors, they're not going to be working. They're not going to be paying taxes to help with the healthcare system. Everything's going to become even worse. And no, I don't have anything against the elderly population. My dad is part of the baby boom. And I think my mom might be too. I'm just saying. Okay? People are on incredible waiting lists. Things are dirty. Things are broken. Just because of the government. They can't slash stupid things. Like, let's face it, we really don't have an army. I don't see why we need to waste so much on it. I'm sorry. It's just absolutely ridiculous things. We need money in healthcare, and we need money in education. Those are the 2 main things, but those are 2 things that are getting cut. Anytime something needs to take a fall, those 2 are the scapegoats. Or at least that's what it seems. This is ridiculous, people. We need to do something about this. I don't know what, but something needs to be done about this. We can't go on living like this anymore. I'm sorry, but if I'm having chest pain, I don't want to be stuck waiting to see a doctor for 2 hours again. Thank God it didn't turn out to be anything serious. But it could have been. This is pathetic.